Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty, and today we will be discussing about the Alzheimer's disease. Okay, so Alzheimer's disease is asked as a short note. In your exams, not as a LEQ, but it can be asked as a short note. So it is an important topic from your university exam point of view. Alzheimer's disease is basically a chronic and a progressive neurodegenerative disease. What do I mean by chronic? I've already told you that chronic diseases are the diseases in which the duration is more than of 4 weeks, right? And in this, there is irreversible loss of neurons. The neurons which are lost forever. They are not recovered, right? There is memory loss, there is cognitive decline. What do I mean by cognitive decline? The ability of that person to think, the ability of that person to take decisions are basically declined. Okay, just like in some of the cases of ours as well, we are not able to take the decisions, like, but that's not Alzheimer's, right? Next, they have the loss of ability for daily living. That is the most common cause of dementia worldwide. Alzheimer's are the most common cause of dementia worldwide. See, why I have kept this figure, you are able to see that this is the normal brain, and in the patient of Alzheimer's, you are able to see the brain is having so many holes and the brain is basically shrinked, right? So that is the brain of the Alzheimer patient, because in them, what is happening? There is a neurodegeneration. The neurons are getting lost, right? If I talk about the prevalence, then the prevalence is 10% after 65 years and 40 to 50% after 85 years. Most common in women, because women have a longer lifespan as compared to men. What are the socioeconomic factors? That is the low education levels. I have already told you, people who are living in rural areas are not having a proper infrastructure, are not having a proper area for the education, and they are not getting proper education. As a result of which, what will happen? There will be it will be the contributing factor of the socioeconomic factor. Then you have the public health relevance. It is the major cause of disability and dependency in elderly. If the person is an elderly and if that person develops this disease, then he may be considered as a burden to his or her family, right? But we should not consider our elders as a burden, right? What are the risk factors you have? Either you have the non-modifiable risk factors, the risk factors which you cannot modify, like your age, the biggest risk factor, you cannot modify the age. The genetic factors, then in the gene you have the chromosome 21, chromosome 14 and chromosome 1, right? And also the involvement of Down syndrome. Down syndrome have chromosome number 21, right? See here, I have given you a beautiful diagram. In this, all the risk factors of Alzheimer's are mentioned, and one day before your exams, I am highlighting the things that you have to keep in mind. So, read this table. What is written in this table? You have the memory loss in Alzheimer's, you have the obesity, you have the hypertension, you have the genetic involvement, diabetes, diet, physical inactivity. The elderly will not be able to involve in the physical activity rigorously, right? And the old age and smoking. What are the modifiable risk factors you have? The modifiable risk factors that you have is your head trauma, is your vascular risk factors like your hypertension, diabetes, smoking, and hyperlipidemia. These are the factors which we can modify and we can change them. Obesity, metabolic syndrome, sedentary lifestyle, poor diet, low education, right? This figure, are you able to appreciate this figure? This is basically a summary table of the keywords. Not the summary, I can say these are your keywords in Alzheimer's. Like I have given you the keywords of Parkinson's as well, right? These are your keywords of Alzheimer's. The keyword that you have is your neurofibrillary tangles are there, amyloid plaques are there, neuroinflammation is there, mitochondrial dysfunction, autophagy, and cholinergic insufficiency. We will discuss them. Just wait a minute. I'm just telling you what are the keywords that you have, okay? Let's see what is the pathogenesis. So for the pathogenesis, you have something called as a amyloid protein. And what happens is that amyloid proteins normally are cleaved by alpha secretase, right? But in the patient of Alzheimer's disease, you have an abnormal cleavage by the beta secretase. If I write over here, in the normal brain, in the normal person, or you can say the amyloid precursor are cleaved by alpha secretase. But in patients who are the Alzheimer patient, in them the amyloid precursor are cleaved by beta secretase. Okay, the beta secretase. This is the main pathogenesis which you need to keep in mind. Next, you have something called as a tau protein. Okay, for that you have a tau hypothesis. What happens is taus are basically the microtubule proteins inside the neurons. I will show you the microscopic image as well, okay? Then you have the cholinergic hypothesis for your Alzheimer's. So what happens is in the Alzheimer's disease, there is decreased in the acetylcholine levels due to the basal nucleus. And this explains why there is memory deficient in patients of Alzheimer's. This basically explains why the patient of Alzheimer's are memory deficits, right? Next you have the gross pathology. In the gross pathology, see this figure. Just remember this figure, right? This one of Alzheimer's. It is looking like somebody has rat bitten, right? The rat has basically eaten your brain. Just remember this. Yeah. So you have a diffused cortical atrophy. Okay, diffused cortical atrophy in your hippocampus, temporal, and the parietal lobes. Then what you have in the microscopic pathogenesis, what I want to tell you about the tau protein. See, tau proteins are like this. Okay, mainly a leaf-like structure, not a proper leaf-like structure, but it's like the tears which comes out from your eyes, the crocodile tears, right? Your crocodile tears are like this only. Okay. So you have the senile plaques that are there. They are composed of the A beta amyloids. Then they are surrounded by the neuritic microglia, which are located in the hippocampus and the neocortex. Next that you have is the neurofibrillary tangles. They are nothing but the paired helical filaments. They are basically the paired helical filaments like this. Okay, they are the paired helical filaments. Okay, then you also have the Hirona bodies. Okay, they are nothing but the eosinophilic rod-shaped bodies. Next you have, there are vacuoles with the basophilic granules that are there in the Alzheimer's, and you will be having the amyloid angiopathy. What is amyloid? Amyloids are that we have read. We used Congo red stain for the amyloids. Okay. Let's see what are the clinical features that the person of Alzheimer have. First one I have told you, it is cognitive. The person is not able to take the decisions properly. Even the day-to-day decisions like what I have to wear today, although we also are not able to take that decision some days, but some days, right? these patients are not able to take the decisions on a regular basis. Okay, then you have the recent memory loss will be there. Like if I ask you that, if I tell you something like, I tell you that I live in Madhya Pradesh, okay, and after some time you ask me that where you live, and I'll say I have told you recently only that where I live, right? So the person is not able to recall what we have said to them 10 minutes earlier. Okay, next what you have is there is language disturbance, and there is motor planning deficits and executive dysfunction. The planning and judgment, the person is not able to take a decision properly, the person is not able to plan his or her day properly, right? This is the figure that you need to keep in mind about the symptoms of Alzheimer's. You have the memory problem, trouble with decision making, forgetfulness is there, the person forgets, right? Then there is difficulty with communication, behavior changes can be seen. Either the person is so happy or either the person will be so sad, okay? Then there will be social withdrawal, although we should be socially withdrawal only because society is not that good. So there is social withdrawal. The patient don't want to stay with the people, right? He just feel like he wants to stay alone. Then there is difficulty in completing the task, and the person is so aggressive. Although I am also very aggressive, but I am not a case of Alzheimer, right? So the person becomes so aggressive with small things also, right? If I tell that person just go and fill the water bottle, he will say why I have to fill the water, why you just can't go and fill the water bottle, right? This. Then there is sleep difficulties, the patient is not able to sleep properly. There are certain amount of time after which the person will wake up from the sleep. Okay, next that you have, next are the symptoms that I have told you. Then you have the stages of the Alzheimer's disease. So you have the preclinical stage, the cognitive impairment stage, mild AD, moderate, and the severe, mild, moderate, and severe. In the preclinical one, you will be having the pathological changes, but then no symptoms are seen. Okay. In the mild one, you will be able to see that the person will have forgetfulness and the difficulty in finding words. In the moderate, you are able to see the person needs help with the daily activities. There is confusion and behavior change. The person will ask you again and again what I have to wear today, what I should eat, what I should do, where I should go, right? Then in the severe one, the patient is basically becomes bedridden. There is incontinence and mutism. Mutism means the person basically decides that he don't want to talk to anyone. He just want to live a peaceful life. We should always be like this, okay, in our life. We should not talk unnecessary to anyone, and we should not backstab anyone, and we should not talk bad about anyone, right? Then there will be rigidity. In the investigation, you have a mini mental state examination that will be give you the score of less than 24. In the imaging, you are able to see in the MRI, there will be cortical and hippocampal atrophy. In the PET, you are able to see the temporoparietal hypometabolism. Okay. What are the complications it can have? The complication can be the person can have fall and fractures, right? Because the person is not at all aware about himself only. He does not know where he is going. He does not know what he is doing. So there are chances that the person may develop the falls and fractures. Then the person are prone to infections like the urinary tract infection, aspiration pneumonia, which is the leading cause of death. The person can develop malnutrition, dehydration, because the person is not having any sense. So he does not even care that whether he has taken the food, whether he or she is hydrated well, right? Then the person can develop the pressure ulcer. Why pressure ulcers? Because the patient is bedridden. Okay, he is not doing any kind of physical activity, as a result of which what will happen? There will be pressure ulcer in that area that will occur. Next, what is the differential diagnosis that you will make? First one is the vascular dementia. Second one is the Lewy body dementia. Third one is the frontotemporal dementia. And fourth one is the normal pressure hydrocephalus. In that you have the triad of gait disturbance. What is gait disturbance? The walking ability of the person is getting disturbed. Then there is dementia and there is urinary incontinence. The patient is not able to control the urinary muscles, basically relaxes very easily. Okay, so this was all about the Alzheimer's disease. I hope I made myself very clear. This will be asked as a short note. Okay, so read this topic in such manner only, and if you are having any sort of doubt, please feel free to reach me. Feel free to DM me. Okay, thank you so much.